Sure. Well, the label I use, kind of a tricky thing when it comes to these um, professions, given that my experience is that every practitioner develops their own set of tools, no matter what label they have on them, right? So, but I'm a neuromuscular therapist, is what I call myself, because I think the best term. Like if you looked it up on Wikipedia, then it describes better what I do than anything else I could label myself as. And, what that translates to is that I'm an expert in how soft tissue behaves, right? To determine whether it's healthy and functional or not, and finding pathways in the nervous system to reset things that aren't working correctly. So the tools that I have in my toolbox, so to speak, would be trigger point therapy. That was the first thing I studied. There's neurodermal modulation, which is something I learned fairly recently that has to do with releasing peripheral nerves to reduce stress in the central nervous system. Neurokinetic therapy, which is a nervous system reprogramming technique. And actually, I actually studied the neurokinetic. Yeah, it's the NKT most, but I also study with a couple other people that have different methods, like the Nemrov method is under the same umbrella. And then recently, because of my focus on chronic pain and chronic, difficult injuries to heal, I have done a deep dive in the last 7 years into the modern neuroscience, using primarily the polyvagal theory as my go-to lens to help people's nervous systems regulate. Because what I discovered, both in my own health and my clients that were chronically ill, like chronic pain and other things, is that nervous system dysregulation is probably the number one cause of perpetuating pain and illness in everybody. I mean, so when I discovered that, and I used it on myself first, had spectacular results. And it's a whole nother story. My whole background of trauma and dysregulation was pretty extensive. So it was no small thing for me to discover something that actually worked long term, because I had not found that previously. And so I put that all together. And so what I do now is I help people with regular injuries and pains, but also chronic pain. And I use that neuroscience as a guide. And I do have therapies that have to do with sound and movement that help
Mhm.
rewire those systems. And those two things do not fall under the umbrella of typical neuromuscular therapist work. Hi, I'm Michael Westgate. Thank you for joining me. I've helped people with chronic pain for over 2 decades. I aim to help you say goodbye to pain and hello to a fully lived life.